Welcome to C3 In This Together, 30 minutes in our own voice. Today, we're talking about disabling disabilities. We'll hear from someone with a lived experience who is coping, managing, and navigating disabilities and special needs. My hope throughout this series, 30 minutes in our own voice, disabling disabilities, is that we will be the generation that creates an awareness that individuals with disabilities and special needs are differently enabled, and that disability does not mean a lack of ability. And I want to lean into that. I want you to lean into that with me, my friends, that again, that individuals with disabilities and special needs are differently enabled, and that having a disability does not mean a lack of ability. Today, I'm so honored to have as our guest one of my dear friends. Her name is Dion Long. She's the mother of two, Deandra and Dakota Long. They are ages 12 and 10. Wow. So we're heading there to the teen years. Mercy. Dion and her amazing daughters are from the great nation of Canada, somewhere up there in Toronto, I believe. So we are so honored to have with us today for this series. Again, Dion Long, welcome, my friend, and thank you for being with us.
Thank you so much.
Well, let's jump right in, and we'll jump right into our questions here. You can tell me a little bit more about yourself if you like, or we can just jump right into our first question, which of course is this: why we're here today. Tell us your story. Tell us about your journey surrounding disabilities and special needs.
Thank you so very much for having me, my friend. It's a pleasure
Yes.
being here and to just talk a little bit about my experience over the past almost 11 years with my daughter, my younger daughter. So I have two children, as you alluded to, Deandra and Dakota. Now, they do share something very unique. They share the very same birthday, exactly 2 years apart. So they're born August 1st, 2 years apart. And Dakota came 1 month premature. And during, I would say, towards the end of my first trimester, I was told that there was something that looks a little off. They're not sure what it is. I was sent for all these different tests. Nothing came back conclusive, but they had an idea that they saw what they considered soft markers for Down syndrome, and they thought that could be what it was. And they've asked that I did a amniocentesis that would give them a much better idea. I refused to do that. Because I do understand that even though it's a very small percentage, that it could often result in a miscarriage.
Wow.
And yes, about 5%, but it could also, it's a bit evasive. So having had a history of miscarriages, I declined. And they said to me, well, we want to prepare you in the event that, your child has a disability. So you could decide whether you want to terminate the pregnancy or carry to term. So I said, regardless of what I find out, I will not terminate the pregnancy. So let's just, put that behind us and, continue with the pregnancy. And, it went on and on, even to the point where if I'd had an abortion, it could have been detrimental to my health. But the doctors kept, pushing me to get this, to terminate the pregnancy. Needless to say, she's here, so I did not.
Yes.
But they even said to me that based on what they saw, that the child would either be stillborn or would live 1 week. They gave her 1 week of life. I took my chances. I decided that. God had the final say, and whatever He decided. If He decided that, He was going to take her back, it would be out of my hands, and I would have to, go with that. But took my chances, and 10 years, almost 11 years this August, she's still here. So we know how the story went. But so she came a month early, And she had some, issues right away. So she was taken from me almost immediately. I barely saw her except for her eyes. I remember seeing her eyes very, very vividly, and just a split second. I saw her eyes, and they were different shaped. They looked almond shaped almost. And I remember doing some research on Down syndrome while I was pregnant, and I asked the doctor as they took her away, does that mean that based on the shape of her eye that I saw, so quickly, is that a characteristic of Down syndrome? And he said to me, we're not sure, but we will find out. So 4 days later, the results came back that yes, she was positive for Down syndrome. I said to him at that point, I said, what do I do now? And he said to me, you take her home and you love her.
Yes.
I will never forget that.
Yes.
It was such a powerful moment that a medical doctor said this to me. You take her home and you love her. And I looked at him and I said, I can do that. Yes. I believe I can do that. And so the work started for me almost immediately. I started researching. I was online all the time, trying to find out sort of what causes Down syndrome. I didn't know all this, that it was this extra chromosome, the 23rd chromosome, that, typical humans have 22. She had an extra one. And what comes with that extra chromosome? What does it entail? But as we'll go through and find out later on, that it's a very wide spectrum. It ranges from very mild to very severe. And my child is somewhere in the middle. And so, yes, I started reading and researching and everything that I could get my hand on. I wanted to find out more because I found out that early intervention meant everything.
Yes, yes.
And so the earlier or the sooner I can do certain things to reach her, whether, in all these different therapies, occupational, feeding, speech, all these different things makes a huge difference in their life. And my aim was I wanted to give her a life, to do everything within my power, to give her the best shot at life, that God forbid something happens to me, I'm gone, that she has all the tools that she needed to make it in this life. That was my aim, my mission.
Wow. Well, what a wealth of resource you've just shared. But above all, thank you for your story, for your journey, and for sharing that with us. One of the things I've been saying around this series is that as you share your story, as others who are joining this series, as they share their stories, it's giving hope and meaning and purpose to others who will also begin to share their own stories as well. So thank you for just giving others the opportunity to hear your story, to live out their story, and to find meaning, hope, and purpose in their own story. And there's so many things that you said that I want to highlight. So many nuggets. You talked about research and the importance of research, and we want to say that to family members, to loved ones. Research is the key, right? Dive into the research to see what it is that you are managing, coping, and dealing with. So
yes.
That really resonated with me. You talked about, and I'll use this word, advocacy, right? Be an advocate for yourself and your family. I can't say that enough, right? The doctors do what they do.
Yes.
Right? They've been given the wisdom. They understand what they're doing, but you are the expert. And I always say this to parents. You are the expert in the stories of your children, right?
Absolutely.
So the expert in the room, it's you, Miss Dion, right? It's not the doctors, it's you, right? So I challenge those of you who are listening, who this is your story, be an advocate for yourself and for your loved one, for your children and your loved ones. And then the other thing that really captured my heart, really hit my human frame is what the doctor said. You take her home and you love her. Mercy, mercy.
Isn't that amazing?
That was amazing, man. Whoever that doctor is, we speak well wishes, we speak blessings.
I have never forgotten him. Till this day, I said, God bless you, Dr. Campbell. Wow. Wherever you are. I don't know where he is anymore, but God bless you, because that has stayed with me all these many years. You
Wow.
take her home and you love her.
You
And
take
that's
her,
where it begins. It
and that's
begins
where
from
it
a place
begins.
of love.
Wow. Wow. Could you just say that again?
It begins from a place of love. You have no choice. You have to operate from a place of love
Wow.
when you have children that are differently abled. You have to pour in like an extra amount of love because they do need it.
Wow, thank you for that. And those of us who this is not our story, you're also helping us to
Yes.
step into that experience. And it begins with a place of love.
Mhm.
This is, we hadn't talked about this, but this is really resonating with me. That, again, those of us who are listening, it's a lesson for us. We ourselves must begin with a place of love as it relates to journeying with
Yes.
those who are
Yes.
dealing with disabilities and special needs. And we can't say that
Absolutely.
enough, right?
Absolutely.
Whoever you are, whatever your occupation might be, whoever you may encounter that's special needs and dealing with a disability, differently enabled, we must begin with a place of love.
Absolutely.
Wow, I love that. Yeah, let's go to the next question. What would you say to someone or a loved one who is managing special needs and disabilities? So speak to the person themselves that they may be journeying, coping and navigating with a diagnosis of being special needs and having a disability. And then also, very important that you speak to the loved ones or the caregivers of those with special needs.
Okay, so for someone living with a disability or special needs, so my daughter is 10 and a half years old. She'll be 11 in August. And um, she's beginning to understand now that what Down syndrome is, the fact that she was born with this and that there is, it's not something to be cured. It's not something to be treated. And so it takes some time depending on the level of their understanding. So intellectually speaking, um, my daughter believes, and quite right, that she's just fabulous.
Yes,
She,
I want to go
you,
like this.
oh yeah, she is extremely fabulous. She is just full of personality, and you cannot tell her that there's something wrong with her. She would tell you that something was wrong with you. She thinks she understands that her speech is not as clear
Mhm,
as everybody else's. So at times she will take her time
mhm.
so that you can understand her. However, if she gives you a couple of chances and you don't get it, she's over. Sorry. But so it does take some time. And that is from, uh, I have now lived in this community, I call it, community with special needs for almost 11 years. And so I've gone to all these different events and I've met so many different individuals from different backgrounds, ethnic backgrounds, different genders, you name it, with Down syndrome. And it has taught me so much. So getting to know these individuals and again, with the spectrum being so wide, where there are individuals who are not mobile. There's some who have needs some sort of help in moving around, and
Mhm.
there's some who, if you've ever watched the Special Olympics, they're very athletic. They're very, so again, very wide the spectrum. And what I do my best to teach my daughter is that she can do anything that she wants to do. She
Yes.
may end up doing it differently, may end up doing it a different way, but if you really want to do it and you know, tell yourself, this is what I want, it can be achieved. I give a lot of credit to my older daughter, who's only 2 years older. But I remember when they were younger, and because Dakota had was early, premature by a month, she had to go for what we call prenatal checkups every few months at the hospital. And I remember at one point, the doctor there said to me, the pediatrician saw the interaction between them both, and he looked at me and he said, pointing to my older daughter, he said, "That is therapy. that you could not afford. So what happens is, and I tell you, God makes no mistakes. He makes absolutely no mistakes, because he allowed my older daughter to be present first. And what she did by being older and a typical child was everything that she did in and around the house. My younger daughter would look up to her and said, I'm going to do that too. Yes. I may not be able to do it exactly the same way, but watch me. Wow. And so she did so many things ahead of a schedule. For instance, most kids with her diagnosis will be wearing a diaper or pull up or whatever, 7, 8 years old sometimes. My daughter was potty trained at 3 years old. Wow. 3 years old, just much like her older sister.
Yes, yes.
She's never wet the bed. And I mean, I remember when I met with, she was just finishing daycare, getting ready to go into JK. And I had to meet with the school board, which I've never had to do for my older daughters. It's a completely different way of life, you know, with her. And I had to meet with the school board, the principal, and all these different individuals to get her ready for JK at 4 years old. And I remember sitting at this table in the boardroom and, you know, telling them about my daughter. And I remember saying they had all these equipment and everything that would be needed to put into the washroom for her and everything. And I said, oh, no, she's potty trained. And so they looked at me like, what do you mean she's potty trained? And I said, well, what does that mean to you? Yes. Where I come from, it means that, you know, right. Don't wear a diaper. You know what you want to do. You'll say what you may need some assistance getting in, but, you know, you don't wet yourself. You don't do anything on yourself. You're potty trained. And they said, but usually, you know, 7, 8, 9 years old. And I said, have you never heard of the exception to the rule?
Yes, yes.
My daughter is the exception to the rule. And that's what happens with early intervention, with having, it's so important. And what I did was I worked very closely with the daycare at the time. So whatever she did at home, she mimics it, the exact same thing at the daycare, because consistency, when you have a child with special needs, consistency is key. It has to, you can't just, you know, throw things at them. It throws them off. So if you kept doing the same thing over and over and over, eventually they get it. So consistency is the key when you have children with special needs. And for someone who's a caregiver, who's taking care of these children, again, I start by saying you operate from a place of love. It's going to take patience. Nothing happens overnight, but it's so rewarding. If I had to do it all over again from the get-go, I will tell you that I would change absolutely nothing. I have no regrets bringing her into this world. I would do it again. So you operate from that place, and you have to pack your patience, because they're going to take you on a journey. You may not, it's not a straight drive. It's not but you're going to get there. And I've seen the capabilities that she has, the things that she can do, that I remember one pediatrician telling me, who I changed within months, that she would never be able to do this. She would never be able to do that. There was nothing positive about what she might do and when she might do it. Because for me, it was not a matter of if, it was a matter of when. She would do these things, but it may not happen on your, you know, timetable, but it will happen. And so it wasn't very encouraging to me, and I couldn't stand around with the negativity. So I dropped him and found another pediatrician who was willing to say, okay, so this is what we're working with, and this is what I need you to do. And again, when you're a caregiver, I have the mindset, I cannot be a lazy parent. I have to know that it's going to take a lot more out of me to reach her, and she's worth it. They are worth it. And so again, doing my research, showing up to these events, find things that will help her. If I told you, I mean, I know we don't have a whole lot of time, but if I would tell you things like everyday thing, I remember when I was teaching her, when she was being taught how to crawl. My older daughter just went from one milestone to the next, no problem. This is what I do next. And she was just doing it. With Dakota, that was not the case. And I remember we had to get a laundry basket, and I would put her on all fours, and I'd put her hand in the basket, and she would be on her knees, and I would move the basket up, and I would center her so she feels level, and I would move the basket up, and she would move her knees up with the basket. And each time, that's how she learned how to crawl.
Wow.
Yeah.
Can I do this, Lady Dion? I want to celebrate the amazing ladies that's in that house. I want to celebrate the amazing woman that's in that house, starting with you, the strength that I hear, the resiliency, the passion, the hope, the love, and I've just got to sit there and just celebrate you, Deandra, Dakota, amazing woman of resiliency, as I said, and strength. And man, that resonated with me. Deandra being therapy
Yes.
for her younger
Imagine.
sister. Oh
Yes.
my goodness. That's something, as clinicians, we help with medication management, and we tell people when you take your medication, it will take 4 to 6 weeks. But my friends, I want you to hear this. When we become therapy to someone, when we become medicine to someone, that takes effect immediately. And that's what hope is.
Yes,
right? Hope
absolutely.
takes effect immediately.
Yes.
And I just want to encourage somebody that's listening, whether this is your story or not, become therapy and medicine for someone who's managing and coping with this. Man, that really resonated with me. The other things I wanted to highlight before we move forward is just something as a clinician that I often make sure that I help those I'm working with, to remind them that you are not your disability. You are not your diagnosis.
Not at all.
There are many who will label whatever it is. In this case, we're talking about disability and special needs. It might be mental health. It might be a medical condition. Whatever it is, you are not your diagnosis. You are not the label. All right.
No.
You are managing that. You are coping with that. You are
Absolutely.
navigating that. And you don't have to give in to that disability.
Nope.
And the other thing is, man, I'm so excited, is the power of a spoken word. Right. I want you to hear
Very
this,
much.
my friends, and what Lady Dion has done, along with Deandra and coming alongside Dakota, is speaking those affirmations of hope and blessings and resiliency and strength. You could become the best version of yourself. Let's say it that way, right? So,
Without a doubt.
man, that really resonated. And again, you mentioned early intervention is the key.
It is
Right?
the key.
It is the key.
Yes.
So yeah, we just wanted to highlight those. Wow. Anyhow, let's go to the next. We could stay here all day. I mean,
Oh, we could stay here for a while. There's so much you could unpack here. Yes.
Yeah, there's a lot to unpack, and you've said it. This is a spectrum, and no two people, no two individual will present and express the same way.
Very
As it
unique.
relates- Very
Very
unique.
unique.
Very, very unique. And we've been saying that throughout this series, that it is a spectrum, whatever the diagnosis is,
Yes.
and how people present and express are just so different, right? They'll express differently as it relates emotionally, socially, intellectually,
Yes. Absolutely.
being mobile, spiritually, right? Biologically, right?
Yes.
We were talking in one of our previous, which will air as well, talking with Master Cole, is our previous interview, and he said, if you've met someone, and in this case we're talking specifically about autism, but it applies here. He said, if you've met someone with autism, you've met someone with autism. If you've met someone with autism, you've met one person with autism. And what he was saying was, each person is so unique.
I agree
how
completely.
They express and manage a disability.
Yes, because I just want to let me touch on that.
Oh, absolutely. Go ahead.
That is so true, because they tend to sort of put these children or individuals into this box. Like they'll say, all children with Down syndrome are very happy. They're always happy. And they tend to look alike and things like that. And I said, first of all, these children look like members of their family.
Mm.
They don't look like somebody else. They may have certain characteristics
Mm-hmm.
that may, for instance, like I mentioned about the almond-shaped eyes, they may have that it could be a characteristic. They may have a sort of a flatter nose, but they do look like people in their family. My daughter looks, I've been hearing a lot. She looks a little like you. It's taken me a while to see that. I used to think she looks a whole lot more like her grandma, but again, someone in the family. And they have emotions like anybody else. They're not always happy. They go through different things. They're very sad. They cry. These things happen. So if you've met someone with that disability, you've met someone, and that's it. So it's so true.
Thank you for highlighting.
Yeah.